Hello, good evening. I'm Dr. Rohan Krishnan, and you are watching Medical Dialogues Presents Health Perspective. Today, we are going to discuss a topic of a concern for all the people in the medical profession, that is the rising problem of mental health among the healthcare workers. Recent studies have shown that India has the largest number of doctors. It is around 1 million. And every year, more than 80,000 doctors are being produced in the country. But from 2015 to 2019, the data says that around uh, 430 doctors have committed suicide, and in such a short span of time. And today also, the cases of mental health illnesses and suicide among doctors are 2.3 times greater than any other profession in the country. So, to discuss this topic, I have with me Dr. Nimesh Ji Desai, sir, who has served as a psychiatrist for more than 30 years. Sir has also served as the director of Institute of Behavioral and Health and Allied Sciences, and is also at this age also is presently working in IHBAS itself. I welcome you, sir, today. I also have Dr. Chinmayee, who is the first year resident of obstetrics and gynecology, and who is also a leader of student wing of Indian Medical Association. And we'll like to start with you, sir, Dr. Nimesh Desai, sir.
Yes, Rohan. Just
Sir,
one small
why?
clarification. I'm no longer working at IBAS. I'm a freelancer now.
Oh, great, sir, great. But I have come to know that you are still practicing psychiatry.
Absolutely. And I will do inshallah till my dying day.
Great, sir, great. So, sir,
Chinmayee, hi, how are you?
Hi, sir. I'm good, sir. How are you?
sir, why is that there is so many cases? If we are taking the data, all our authentic data approved by NCBI, that the
Sure.
suicide among doctors is a lot. If you see the numbers itself are telling that the doctors are getting depressed. Why is that so?
Um, Something occurred to me, Rohan, as you were saying what you were saying in the introductory remarks, that 50 odd years ago in my medical school, when we were reading the textbooks, there was one textbook of pathology that wasn't very popular then also, but was a very good one. William Boyd. Boyd's pathology was so well written, that apart. Boyd's pathology and a lot of other data in the 60s and 70s, if not before that, have always said, and Boyd's pathology said it tongue in cheek. One, that completed suicides, unfortunately, are more common amongst medical doctors as compared to general population, and that completed suicides were, and I think still are, more common amongst medical specialties in two groups: psychiatrists and pathologists. Okay. Now, it struck me right then as a young medical student and say, why is that? One of the explanations has been that although all of us do heavy duty work and deal with difficult situations, and the emergency room people do much more, somewhere the understanding has been that psychiatrists and pathologists seem to see really the morbid part of the society. So maybe that's one explanation. But more importantly, what I want to draw your attention to, and Chinmayee and everybody else, is that ultimately the understanding is that better knowledge will lead to correct, more positive, appropriate attitudes, and that will lead to proper healthy behavior. Unfortunately, that is not to be the, I paraphrase from there. Even knowledge about psychiatry in itself will not be enough. So while through you and all these such forums, I'd like to spread amongst our young medical doctors awareness about depression, about mental health problems, about seeking help. What I think is very important to realize is that young medical students, resident doctors, and all of us at every stage of life need to learn and need to be trained in better coping, because there is no escaping the fact that medical life is going to be stressful, maybe less or more, maybe very bad, maybe slightly okay, but coping with stress is perhaps the most important thing that we can do and we should do. So I will underscore one more time, mere information and awareness also will not help. We will have, and we all know that, right? If you reflect for a minute, it's not as if our young colleagues who attempt or who unfortunately die by suicide completion, it's not as if they don't know in theory that depression hota hai, that can lead to this. What is difficult is the implementation of that knowledge. And there are a few other blocks which we can come to in the later part of the discussion. But I don't know if you and our young friend Chinmayee would agree that the major issue is converting that knowledge to sensible coping with stress.
True, true. I completely agree with you, sir. I'll like to come to Chinmay and ask one thing, that what are the problems that are relating to mental health issues among the residents, among the PG residents, among junior residents. What is that? Because I know for sure that it is maximum at the level of residents. So what is that that is creating this much of depression and mental health problem?
Thank you, Rohan, for giving me this opportunity to talk on board. But as you said, among like almost around 70 to 80% of these loss of lives are among resident doctors only. This it may be due to like various reasons, like working for 4 to 5 months without leave, lack of relaxation, lack of entertainment, or maybe low pay scale, and many such reasons, and strained relationship with the senior staffs, everything. And another major thing is how we deal, like how we deal with the deaths. Like though we give 100% of our thing, we'll be blamed for any deaths happening in our thing. And also at times we are assaulted, we are humiliated for the things which was not under our control. And in many advanced countries there will be assessment of the mental health of the healthcare providers, and there will be report according, and there will be confidential services to come out of that also. But in India as such we don't have anything like that. And though we speak a lot, as sir said, though we speak a lot about mental health and all, we ourselves are are reluctant to seek help for it. It may be because of the stigma associated with it, or how our colleagues treat us, because if we tell that we are in under depression or we have some mental issues. So just creating awareness won't help. We should try to implement that knowledge, what we read in our textbooks, into our life. And we should realize that we are already going through a lot of stress, and it's okay to be like this. And we should talk about it, and it's okay, every one of us are going through the same stage. And I also say that though we have strict norms against ragging in India, ragging is still going on under the table smoothly behind the screen. I'm sorry to say, even seniors rags as baby professors, HODs, or staffs. I request them to be little liberal towards their juniors, and tell things in a nicer way, so that we understand things and we don't feel like end our life at that point of time.
Okay. Sir, I would like to come to you regarding this. That what should be the management of all this? We know the problems. We know everything. What Chinmay is saying about dragging, I personally feel that this is one of the problems that the resident doctors do face. That it could not be just dragging per se, that sing a song or do something, or even talking to you very harshly at every point of time, or even the directors and professors sometimes acts like they are the gods, and you cannot enter into their room, you cannot talk to them. And I think that there is that problem which the resident doctors do face. So what should be the management part of it? Because one part, so I see that I have myself have been very strict when it comes to ragging. If some student tells me about it, I complain it on all the levels. And I've seen that NMC is quite strict on that. Once we mail to National Medical Commission, they immediately respond. They send the mails to the deans of the medical college. They involve the local police as well. So I think that after involvement of local police, the management of the college also gets involved. So National Medical Commission is pretty strict on this. But in general, when we talk about mental health awareness, should this awareness of politeness also in doctors, in senior professors, should be there?
Soft skills, including communication and empathy, as you are hinting. Allow me to address this head on, the last part, and then of course we'll come to a lot of other wonderful things that Chinmayee said and you are capitulating. I don't know if any of the people around in this session would have ever worked with me at IBAS. That I must say, 23 years at IBAS, turning the old Shalga Mental Hospital to IBAS, I was a Hawkeye. God help you if there was negligence. Okay. And I will say easily, one of my nightmares would have been if one of my PG residents got so troubled as to even attempt. But touch wood, 23 years, we had great rapport. The point that I'm making is besides everything else that Chinmay and you are saying, system level and every other action, even if there is, and I do believe that medical teachers as supervisors have a tough job, because like I've often said, my obligation is also to my patient beside to you and Chinmay, right? But there can always be a correct mix of being strict and being empathic. In fact, I've been very fond of saying this, and some people have said this to them on their own, to me on their own. If you remember Three Idiots, my claim now at least is that, or even Munnabai, same paradigm. My claim has been that even before the movies were made and after movies have been made, I have crystallized this more in my mind that I would like to be a good mix of Rancho and Vishnu Sahasrabuddhi. Okay. While I would be a stickler for the system, including patients' rights, I would be as empathic and irreverential as Rancho or more, so that cases like Joy don't happen. Now that's one part. I hope I've got some idea across there. Some other time maybe we should talk about this. But there are important issues that Chinmay also raised and you raised. NMC should be strict, local management should be strict, there should be avenues for grievance redressal, everything else. But what's also crucial is, like Chinmay and we are both saying, coping. Because see, the trouble with medical doctors, Rohan, if you realize, and all of you young friends, and don't fall prey to this. Again, there's a lighter side to this, but I'll come to that in a minute. Or maybe I'll begin with the lighter side. What is one of the commonest beliefs about psychiatrists in the society or even medical doctors? Let's face it, that more than half of you are yourself off balance, right? Pagalonge doctor, are they, right? Now, my response to that has been forget other parts. The point is this. See, society puts us up as doctors on a pedestal, expects too much, makes us feel like gods and demigods, and then a few of us who may not be able to cope. Don't fall prey to that. As Chinmay and I are both saying, I am as human as anybody else. You and Chinmay and all of our young colleagues, or even my group colleagues, are all as vulnerable as any other human being. The thing is, help seeking behavior for problems when they exist must be facilitated and made more easy. The fact is that medical doctors themselves will not look upon a colleague with respect, equal continued respect, if he is taking treatment for depression. Unfortunately, this is true even within mental health profession, and I don't mind saying this. I have said this and written about this at many places, that, like the word goes, charity, so to say, will have to begin at home. Destigmatization of mental health problems and help-seeking behavior will have to begin at home, first amongst us psychiatrists, amongst us medical doctors, and then to the rest of the society. I often challenge psychiatrist groups. How many senior doctors, including psychiatry team leaders, would be comfortable to go and say on a rounds day and say, look, today I'm not feeling too well. I had an argument at home, or I didn't sleep well, or that, I went to a party late last night, whatever else reason. Let's begin this destigmatization, not just factual fact of mental illness, but help seeking behavior. this omnipotence, this खुदाई की भावना जो है ना कि we are all above it, we are not superhuman. Okay, neither psychiatrists nor medical doctors are superhuman. Of course, I agree with many other things that Chinmayee said. I won't even repeat them. All issues of the pressures, the exploitative system, exploitative HODs who are not even empathic. I do believe that youngsters and our young medical colleagues actually recognize very well, even if the systems are strict, as long as the strictness is about the system and patient care and does not get personal, one. Two, as long as there is accompanying empathy and enough care. My conviction in these 40 years all through has been that youngsters are very good to recognize that. Of course, let me also say that even on mental health teams, Rohan, we have had staff members, we have had faculty colleagues, and we have had postgraduate residents who were going through mental health issues. Okay, RDD, bipolar disorder, broken affair, something else, family issues. Now, all of us, not just psychiatry departments, but all of us as supervisors need to be alert to pick up those and help those who are in need of support. So, can we walk that thin line as a system? I do believe, if I may say at the end of this segment, I do believe that we are doing better than we were doing. The exploitation by seniors, exploitation by the system, the lack of considerate empathy by the system was much worse 30 or 40 or even 20 years ago. And that is wrong. Kudos to many people like you and all the youngsters. You know, we need to bring in more and more of the rights of the young doctors. I hope that covers some part of it. Yeah.
Yes, I completely agree with you, sir, that there is one thing that we also must understand, that we are not superhumans, and we have to cope up regarding all this, and one should be open enough to accept that, okay, I'm going through this illness, or I'm being depressed, or as simple as that I don't feel like working today because I've got some problem today at home. My mind is occupied there itself. So that is something which is very important. And second thing also, which you have highlighted, that charity begins at home. I have seen myself, one of my psychiatrist PG, undergoing treatment for bipolar, and he is not sharing it with anyone else because he himself is feeling that he will be outcasted in the department of psychiatry itself. So the irony of this is
That
that
is sad.
if a
That is
psychiatry
sad.
PG is feeling that he will be outcasted in the department of psychiatry for a mental illness. So I think that
Yeah.
this is something that all of us should focus. Sir, I'd like to have a concluding sentence with you regarding how to make sure that people come out. If you are feeling something, how do you went out? How do you can seek approach? And when should you think that it's time for me to consult a proper psychiatrist or not psychologist? Let's go directly to a
Right.
psychiatrist.
Psychiatrist.
I
Yes.
should go.
Yes, before I forget, if I understand right and if I didn't miss, I think what Chinmay said was very important about what was that? Yes, reaching out when one is in distress. Reaching out when one is in distress. Chinmay, remind me something you had said, and I'm forgetting. Something you had said very well. Do you
So
remember?
annual assessment of mental health, was it that?
Sorry.
Annual
No, I'm
assessment
trying
of
to recall
mental.
what you said. I'm sorry, I seem to have missed. But in any case, to answer Rohan's question, I'm sure I'll get it back. The most important thing is to destigmatize in terms of help-seeking behavior. Let's repeatedly say that it's okay not to be okay. And Rohan, like you said, yes, unfortunately, most psychiatry departments, with all respect to my colleagues all across the country, I'll say, still haven't reached that level of acceptance and refinement. You know, um, so normalize it. Let me also say this: we'll get there. 20 odd years ago, I was attending a meeting of the Royal College of Psychiatrists, and would you believe, Rohan and Chinmay, the sitting president of the Royal College of Psychiatrists, at least in the after dinner talk, actually spoke about his treatment for depression. You know, And I thought that was great. So we'll have to talk about this more and more. But there's some other point that I'm forgetting. I'm sure I'll get back. Chinmayee, please go on.
Sure.
Yes, Chinmay.
Yeah, like the one thing is what I suggest to doctors is try to have a life outside hospital, try to develop hobbies and interests that keeps you entertained or something, which gets you out of these things basically. Because if you are like over enthusiastic and over dedicated in your work only, and if you are not having any other hobbies or interests, that will keep you in a loop of depression only. So try to develop other interests, be it business or anything, sports, business, gym, go to gym, go dance, sing, anything that helps you get out of it.
Can I just quickly add? Buffers. Chinmay is completely on the spot. Have buffers. Now, again, see, some of us are lucky, high personality, psychobiologically, genetically, to have inbuilt internal buffer systems. Some of us may not be that lucky. Like Chinmay is saying, please examine yourselves and help your friends. If some people are by persona not endowed with buffer systems, please introduce buffer systems. Inculcate those habits like Chinmay is talking about. So not all of us are made the same way. And one more word of caution here. While, and I actually maintain this all through, while meticulousness, while being conscientious, while being caring for the patient and every life saved is very important to our profession, please be also careful about that not being overdone. In our language, what is called obsessive personality. Okay? Even if you find you yourself or your friends have too much of conscientiousness, too much of meticulousness, be careful, because people, and especially young people or in my age group, adolescence, early adulthood, and old age are the two periods when this risk is highest. People with obsessional personality traits or disorder problem are much more likely to have depression and suicide attempt. So, in simpler words, if I might say, be sincere, but don't be hard on yourself. Sincerity is different from being unfair to oneself.
True, I completely agree with you, sir. And I've also heard about this thing which you have always you say, and I feel it that it is very important for all the young viewers and everyone who is watching that one should have buffers. Whatever gets you going, that should be there. Be it music, be it playing some games or whatever it is. Whatever is, some people write, some people paint, but there should be some buffers, and we should promote these things. It is not that I've seen that few of the people are so much tense that they think that even if they take a small break, it will be very difficult for them to cope. That should not be the issue. There should be a difference between sincerity and getting OCD about something. So, sir, time is
Like
today
we
is
all
very,
know,
very less.
work-life balance is important also for doctors, and much more for doctors than even general population.
True, sir. True. We are planning planning a whole list of show for mental health awareness, because it is becoming a
Yes.
very important topic, and we cannot cover it in one day or one session. So we have planned 5 sessions for this, and we shall meet again, sir. And we shall talk about it. Next time we'll be having some senior also who will talk about their problems, because today I wanted to cover the resident doctor part of it. Next time I want to cover the assistant professor and professor part of it. So see, as you said, that it could be among the young age, among the older age group. So we'll have your wisdom in all parts of it. So let us continue this journey and do whatever we can for mental health awareness. Thank you
Great
so
job,
much,
Ron.
Dr. Chinmayee and Nimesh Desai, sir.
Pleasure, sir.
Thank you so much, sir. Thank you.
Thank you.
Bye.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.